Ashley. Well, millions of Americans suffer from migraines, often debilitating headaches that can come on suddenly. June is Migraine Awareness Month, and it's a perfect time to talk about migraines and treatment options. Here to sort it all out is Dr. Brian Grossberg, Director of the Hartford Healthcare Headache Program. Doctor, welcome. Thanks for being here.
Well, actually, I'd like to reintroduce myself. My name is Sandhya Mehla, so I'm replacing Dr. Brian Grossberg today for this brief talk.
Excellent. Thank you for correcting that. I looked at you and I said, wait a minute. Okay.
No problem at all. So it's a pleasure to be here and talk about migraine, absolutely. So I'm more than happy to answer any questions that you may have.
Excellent. So, doctor, first tell us, what exactly is a migraine and how does it differ from a regular headache?
So first of all, I'd like to answer the second question first. So headache is a symptom, whereas migraine is a disorder or a disease. Migraine is a neurological disorder. It involves not only headache, but other symptoms like light sensitivity, noise sensitivity, nausea, and it sometimes involves, or patients can experience neurological symptoms when we then classify it as migraine with aura. It is a very common disorder. It's the third most disabling disorder in men and women under age 50. And typically, patients experience a headache that lasts between 4 to 72 hours. Throbbing in nature, can be one-sided or both-sided, but very disabling headache and very disabling neurological symptoms with it.
Yes, I've seen it firsthand from a loved one. All right, when should someone see a specialist?
So, to this, I would like to say there are many different headache disorders and many medical conditions which can present with headache as a presenting symptom. So it's very important that patients with new onset headache seek medical care appropriately to determine if the headache is from a medical condition. And for migraine, so if patients are noticing that it's affecting it's interfering with their life, or they're noticing a regular need to take over-the-counter medication, they should seek expert advice so that we can prevent the disability.
All right. Tell us about the latest treatment options for migraines.
So, yes, it is a very exciting time for migraine because previously we used to use medications which were developed for other medical conditions and then studied for headache and used for migraine. But we have newer medication options available now which were studied exclusively or developed exclusively for migraine. So we use various medications starting from abortive therapies which are used to abort a migraine attack to preventive therapies like oral medications, onabotulinum toxin, which is done as injections in the scalp, and then monthly self-injectable medications, which are monoclonal antibodies, the anti-CGRP antibodies. And then we also have some neuromodulation devices which can be used for acute and preventive therapy. And then we, at the Headache Center, at Hartford Healthcare Headache Center, we approach headache in a very comprehensive manner. We have collaborated with Headache and Hormone, Headache and Pregnancy, Physical Therapy to get more of a patient-centered, customized approach to each patient.
All right, doctor, thank you so much for your time. Great information. Glad it's exciting times, too. Dr. Mehla, thank you.
Yeah, no problem.